Hi Sophia, I'm going to be your student nurse today, so we're just going to do a head to toe assessment.
Okay.
And then this room is completely confidential. Everything that we do, nobody will know.
Okay.
You ready to get started?
Yep.
Okay, so we're going to do the nose chart first.
Okay.
So if you'll just stand over here and cover one of your eyes, we're going to start and just read off of this chart.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C.
Okay, so you have 20/20 vision in that eye, so if you'll do the other one.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C.
Okay, so you have 20/20 that one, so now we're going to do both eyes.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C.
Okay, so you have 20/20 vision. So now I'm just going to watch your gait, so if you'll just walk to me heel to toe. Okay, that looks good. And then will you hop on one foot for me, and then the other. Okay, now we're going to do a test. It's called the Romberg exam. So if you'll just close your eyes, and we're going to check your balance. And then if you feel dizzy or you start to lose your balance within 20 seconds, then you have failed it, but you look good. So if you want to just turn, we're going to do a scoliosis exam. So bend over and touch your feet, and I'm just going to check your spine. Okay, it looks good. So if you want to just have a seat for me, I'm going to check your scalp. Okay, have you had any scars or lesions or any problems? Okay, just let me know if you feel a little tender. Any tenderness? Okay, now I'm going to check your sinuses. So I'm going to do your frontal first, any tenderness, and then your maxillary, any tenderness. Okay, that sounds good. And now I'm going to check your ears with this otoscope. I'm looking for the cone of light. Okay, the cone of light is at 5. And the cone of light is at 7. So now I'm going to do a whisper test. So I'm going to go behind you, and if you'll just repeat after me. So if you'll cover one of your ears. Okay. Blue pillow. Okay. And then now the other one.
White blanket.
Okay. So I'm going to check your eyes. So we're going to do the red light vision. So if you want to just look at that wall, I should be able to see a red light in your eyes. And then if it's not there, then that's abnormal. Okay. And then now we're going to do the coronary light, so if you'll just look at me. And now we're going to check your perla. And your pupil should constrict. Okay. And they constricted. So now we're going to start doing your cranial nerves. So if you'll just close your eyes, and if you'll identify the smell.
Peppermint.
Good. And now to check cranial nerve 2, if you'll just close one of your eyes, and then if you'll just tell me whenever you see my finger, okay?
I see it. I see it. I see it.
Good. Now the other one.
I see it. I see it. I see it.
Good. Okay, now to check cranials 3, 4, and 6, if you'll just focus on me without bending your head, if you'll just follow my finger. Okay, good. So now to check cranial number 5, I'm gonna have you clench your jaw, and I'm just gonna feel, okay? See how strong it is. Is that hurting? No tenderness? Okay, good. And then now for cranial number 7, we're gonna check your sensory to see if this is sharp or dull. So if you'll just close your eyes and tell me which one.
Soft. Soft.
keep them closed. Sharp. 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 Good. Okay. And then for cranial number 8, that's your hearing, and we have been talking, so I understand that you're hearing me. And then for 9 and 10, I'm just gonna look inside of your mouth. Okay. Say good. Your membranes look pink and moist. And then for cranial nerve number 11, I'm gonna have you shrug against my hands. Good. And then for 12, if you'll just stick out your tongue and move it from side to side. Good. Now I'm gonna check your thyroid. Have you had any thyroid issues? No. Okay. Let me know if it's tender. Okay. Now we're gonna go from one side and then to the other. Good. And now we're gonna do your range of motion in your neck. So if you'll just do down, back, and from side to side. Good. And then we're gonna check your range of motion in your arms. So this is prone, supine, and then abduction and adduction. Good. So now we're gonna check your strength in your upper extremities. So if you'll pull, push, good, and then push, and then pull, good. Okay. And now I'm gonna listen to you. Okay. Good. So I'm going to start right here. I'm going to go down to, and this is your aortic. I'm going to slide over, and this is your pulmonic. Okay, I'm going to go down to, and this is your herbs point. And then to your fourth intercostal is your tricuspid. And then I'm going to go down your mid-clavicle line. Right underneath of your nipple line is your mitral valve. And those all sound good. So now I'm going to start listening to your lungs. I'm going to start above your clavicle. Good. Just breathe normally. And you want to check bilaterally. Okay, and then I'm going to have you raise your right arm because you have an extra leg here, so I'm going to listen. Okay, and now I'm just going to listen to your back. Lungs sound good, so now I'm going to check for CVA tenderness. And let me know if you feel anything. Any pain with that? No? Okay. Now I'm going to listen to your excursion, so if you'll just breathe in. Okay? And that appears to be normal. Okay. Okay, so now I'm going to listen to your carotid root, and I'm just going to listen, and you hold your breath, okay? And now I'm just going to feel your pulses. Actually, let's do a breast exam first. So if you'll just lay back for me. Do you do breast exams on yourself? Okay. So you want to do it 4 to 7 days after your last menstrual cycle. And then once you hit menopause, you just want to pick a day that's convenient for you. Like, that's easy to remember. Okay. So you'll want to put one arm on top of your head, and then with the pad of your 3 fingers, you'll just want to feel from your axillary all the way down from your chest wall. And you want to do it soft, and then medium, and then hard pressure. And then you shouldn't feel any lymph nodes, enlargement, or nipple discharge or anything like that. Okay. And then you want to do it bilaterally. Okay. And then I'm just going to listen to your abdomen. Your bowel sounds are normal active, and now I'm just going to palpate your abdomen and you let me know if you have any tenderness. And you just want to do some deep pressure on that, and just let me know if you feel any tenderness. Okay? So now I'm going to put your pulses so if you want to sit on the side of the bed. Okay, I'm going to start with your radial. Now I'm going to do your popliteal. Okay, now I'm going to do your posterior tibial. Okay, now I'm going to do your dorsal penis. Okay, your pulses feel good, so I'm going to check your capillary refill while I'm here. And they are normal. They are under 2 seconds, so I'm going to do your thumbs now. Okay? And those look good, so now I'm going to check your reflexes. Just want to relax. This is the tricep one. Okay. And now we're going to do the bicep. Now your thumb. Gonna find the notch. And now your knee, your toe. So just wanna relax. So I'm going to do your posterior tibia. Okay. And that concludes our exam. So do you have any questions?
Thank you.
Thank you.
Hi, my name is Michelle. I'm going to be your provider today. Can you tell me your name
Barbara,
and your date of birth?
January 7th, 1996.
Very good. And can you tell me today's date?
Today is September 24th, 2023.
Awesome. So we're going to go ahead and do an assessment on you. So far, I can tell you're alert-oriented times 3. You have a very positive mood. You're communicating effectively. I'm going to take a look at your head. It looks round. It's normal cephalic. I don't see any malformations or indentations. Is it okay if I palpate your head? Tell me if you feel any tenderness.
No.
Okay. Your hair is evenly distributed. I don't see any flaking. I didn't feel any masses or anything like that, so that's all normal. Now I'm going to take a look at your eyes. They look midline and even, symmetrical with each other. I don't see any ptosis or drooping of your eyelids. I'm going to have you close your eyes and try to open your eyes. Good. And next I'm going to check your pupil reaction. So, also I see that your sclera is white, your corneas are clear. I can see your pupils look even. So right now I'm going to check your direct pupillary reaction. So I'm going to shine a light in your left eye, and your left pupil constricts. Now I'm going to shine your right eye, and your right pupil constricts. Very good. Now I'm going to check your consensual pupil reaction. So I'm going to shine the light in your left eye and see that your right pupil is constricting, and I'm going to shine in your right eye and see that your left eye is constricting. Very good. And your pupils, I would rate them a 3. They're brisk, they're evenly reactive, they're round, all very normal findings. So now I'm going to make sure your eyes are aligned. I'm going to shine this light in your eyes, and I see that the light is reflecting off of your pupils at the same spot on each eye, so that tells me that your eyes are aligned. Now I'm going to do the cover and uncover test. So I'm going to have you focus on that object on the wall and cover one eye. And now I want you to uncover that eye. Very good. And now do the same with the other eye. Okay, uncover. Very good. So your gaze didn't deviate. You stayed focused on that object, which is normal. So now I'm going to do the 6 cardinal fields test. I want you to follow this object with your eyes, but without turning your head, okay? Very good. So that showed me that you have good conjugate parallel movement of your eyes. So this is all checking your extraocular movements, making sure that they're intact. So now I'm going to check your visual acuity. So I'm going to have you hold this chart 14 inches from your face. And I'm going to have you read the lowest line that you can. With
4,
one eye.
2, 6, 7, 3, 9.
Very good. And the next eye?
4, 2, 6, 7, 3, 9.
Good. So that shows me that your near sight is 20/20. Now I'm going to test your central vision. So I'm going to have you look at the Snellen eye chart right there, and while covering one eye, read the lowest line that you can.
L, P, F, P, H.
Good. And with the other eye?
L, P, F, P, H.
Very good. That shows me that you have 20/20 vision, central and nearsighted. Very good. Okay, so next I'm going to test your peripheral vision. So I'm going to have you cover your left eye. And I want you to just look at my face, but I'm going to be holding up a number in the 4 peripheral quadrants, and I want you to tell me what number I'm holding up, okay? So just focus on me.
2, 1, 3, 1.
Good. And now other eye?
2, 1, 3, 2.
Good. So your peripheral vision is nice and intact. Very good. I just want to make sure I look at your lacrimal apparatus. It looks good, patent. There's no nothing clogging it. Doesn't seem. I'm going to check your conjunctiva. Nice and pink. Very good. Nice and pink. Awesome. All right. I'm going to have you smile for me. Frown. I'm going to have you turn your head against my hand. Very good. Good. And I'm going to have you shrug your shoulders. Very good. That's all normal findings. I was just testing your cranial nerves 5 and 7. I'm also going to test your facial sensation. This is a test for cranial nerve 5 and see if that's intact. Tell me if you feel both sides equally. You do? Okay, good. That's intact. Very good. I'm just going to have you open your jaw too. Okay, good. Next, I'm going to take a closer look at your eye with my ophthalmoscope. First, I'm going to check to see, visualizing your retina. I see the red light reflex bilaterally, and that's a normal finding. Now I'm going to visualize your optic disc. So it's round with clear margins, and it's a creamy yellow color. And same on this side, so that's a nice normal finding. Very good. All right, now I'm going to move on to your ears, which appear symmetrical to me. I'm going to palpate, that's okay. Do you feel any pain in your pinna, your lobes? How about your tragus? Any pain? Do you feel pain when I touch your mastoid process?
No.
Good. So now I'm going to go ahead and take a look inside your ear with my otoscope. First, I'm going to look at your external canal. It looks fine. There's no foreign bodies or anything, no swelling. I'm going to pull your pinna up and back so that I can get a closer look inside your ear. Your internal ear canal Shows no signs of swelling, no foreign bodies present. And then I can visualize your tympanic membrane. It's pearly gray, it's translucent and shiny. It's a good normal finding. I'm gonna look on the other side. Your ear canal is free of any obstructions, no swelling, no drainage. Now I'm gonna do the same on here to see your internal ear canal looks good as well. And then your tympanic membrane, I can see again, it's pearly gray, it's shiny, and it's translucent. Very good, normal findings. So now I'm going to test your hearing acuity. So what I'm going to do is have you occlude your right ear, and I'm going to whisper a word over here, and you're going to tell me what word I'm whispering.
Cat.
Good. And the same on the other side.
Pencil.
Very good. So you have positive whispered word. Now I'm going to do the Ryan's test. So this test to see if your bone conduction is intact and your air conduction. So I'm going to activate this tuning fork. You tell me if you can hear that sound, and tell me when it stops.
It stopped.
And can you still hear it? And tell me when it stops.
Okay, it stopped.
Okay, good. And the other side. Can you hear the sound? Tell me when it stops.
It stopped.
Okay. Can you still hear it? And tell me when it stops.
It stopped.
Very good. So your bone conduction and your air conduction are both intact. Now I'm going to do the Weber test to make sure that you can hear equally in both ears. So again, take my tuning fork. Do you hear the sound more in one ear or equal?
Equal.
Both equal. Okay, good. That shows that your hearing is nice and equal. So next I'm going to move on to your nose. It appears smooth and symmetric to me. I'm going to palpate any pain or tenderness. Okay, good. Now I'm going to look in your nasal cavity. I see that your septum is midline. It's not deviated. It's intact. And then I can see your nasal mucosa is nice and red. It's moist looking. So that's all normal. No swelling in there that I could see. Now I'm going to check the patency of your nostrils. So I want you to hold one nostril closed and breathe through the other one. Good. And then the same on the other side. Good. So they're both patent. Now I'm going to test your smell. So I'm going to have you close your eyes and include one nostril and tell me what you smell in the other one.
Cinnamon.
Yes. Very good. And the same on the other side. Keep your eyes closed.
Pepper.
Good. All right. So your smell is intact. Next, I'm going to check your sinuses. So I'm going to palpate your frontal sinus. Any pain?
No.
I'm going to palpate your maxillary sinus. Any pain?
No.
Okay, good. I'm just going to percuss. Okay, good. No obvious signs of sinusitis. So I'm going to move on to your mouth and your throat. Your lips appear nice and pink. There's no cracks, no bleeding, and no growths. So I'm going to have you open your mouth for me. Very good. Your buccal mucosa is nice and pink and moist. Your teeth are straight. There's no debris. Your gums are nice and pink. No swelling or bleeding that I can see. I'm going to have you open your mouth and say ah. Good. I see that your soft palate is moving upward bilaterally when you say ah, and your uvula is staying midline. So that's all normal findings. Let me take a look at your tonsils. Good. So I would call them a grade 1. I don't see any cobblestoning, so they look nice and normal. There was no exudate. I'm going to have you say A-E-I-O-U.
A-E-I-O-U.
Good. So your words are coming out normal, no slurred speech. That's checking also your cranial nerves. I want you to stick out your tongue for me, straight, and move it side to side. Good. And then I'm going to have you press your tongue against your cheek. Good. And the other side. Good. So no weakness in the tongue. That's good. I'm also going to check your gag reflex. Say ah for me. Okay, good. Positive gag. Perfect. Sorry about that. I didn't notice any odor from your mouth. I'm also just going to test your taste. If you can just close your eyes and stick your tongue out and you tell me what you taste. Sorry, honey.
Cinnamon.
Good. All right, so your taste is intact. Very good. All right, so now I'm going to move on to your neck. So it looks symmetrical to me. No hyperpigmentation, no thickening of the skin. I'm going to go ahead and palpate. Any pain or tenderness? Okay. Next, I'm going to go behind you and have you swallow. Good. So I can feel your thyroid moving up and down, which is normal, and I don't feel any nodules, which is a normal finding. Your trachea, let's check that. feels nice and midline. I'm going to check your carotid pulse. Good, it's +2. Feels normal. Now I'm going to check your range of motion, okay? So I'm going to have you look to your right, look to your left. I'm going to have you put your right ear to your shoulder, left ear to your shoulder, look up at the sky, and then tuck your chin to your chest. Very good. So the range of motion is all normal. I'm also going to go ahead and auscultate your carotid artery. I didn't feel any thrill when I palpated it. Make sure it sounds normal. Good. Good. So I didn't feel any I didn't hear any grooving. Okay. Next, I'm going to check your lymph nodes. You tell me if you feel any tenderness, okay?
No.
No tenderness? No tenderness? Okay, good. I didn't feel, they weren't palpable, so they're not swollen. I didn't feel any tenderness, so that's nice and normal. Now, I'm going to move on to your respiratory assessment. So, just looking at you, your skin is a nice color. I don't see any pallor or cyanosis. I don't see any pursed lip breathing. I don't see any nasal flaring. So that's good. Let me see your fingers. Good, no clubbing noted. Your earbuds aren't cyanotic. Now I'm gonna just look at your thorax. I can see you have an obvious rib cage or clavicles. Looks symmetric and even. I'll look on the back. Everything looks symmetric and normal. So now, I'm gonna palpate. Is that okay? Okay. Your thorax feels normal. Your sternum and xiphoid process are firm. They're not movable. Yep, everything feels normal back here. So now I'm going to check your radial pulse. Okay, good. So I was actually counting your respirations. You're breathing at about 20 respirations per minute, which is normal. You're breathing easily. You're not having increased work of breathing, so that's all nice and normal. I already felt that your trachea was midline. Now I'm going to I'm going to palpate while you take a deep breath. Good. And on the back, I'm going to do the same. Go ahead, take a deep breath. Good. So your chest is expanding symmetrically bilaterally, which is good. Next, I'm going to do the tactile feminist test. So I'm going to have you say 99.
99, 99, 99, 99.
Good.
99,
Mm-hmm.
99,
Yep.
99, 99.
Good. So I felt the vibrations equally throughout, which leads me to believe that you don't have any lung consolidation or anything like that. But next, I'm going to auscultate. Actually, I'll percuss first. So I'm just going to percuss. And on the back. Very good. I heard resonance throughout, which is normal. And now I'm going to auscultate. Okay. I'll start at the front. Good. And then I'll sit on the back. Very good. So I heard your lung sounds equally and bilaterally and throughout. They were nice and clear, which is a normal finding. Now I'm going to have you sit facing this way. So what I'm going to do is I'm going to have you take a deep breath and hold it. I'm going to percuss. Okay, you can let it out. I'm going to mark that with a pen. And now I want you to breathe normally for a second. And then I'm going to have you take a deep breath and exhale all the way and hold that breath out. Percuss, and mark that, okay? So that line that I just made is about 4 centimeters. So that's your diaphragmatic excursion I was testing. And it's 4 centimeters of movement, which is normal. That just shows me that your diaphragm is moving appropriately. So that's very good. Okay, next. All right, I'm gonna move on to your cardiovascular assessment. So your general appearance, your color looks good. I don't see any modeling, no cyanosis anywhere that I've seen so far. I'm gonna palpate your extremities. I don't feel any edema anywhere, so that's good. I'm gonna assess you for a jugular vein distension, so can I please have you lay behind this chair? You can look to the side. Okay, and I'm gonna have you look to the other side. Very good, no jugular vein distension, awesome. You can actually stay laying down for me. I'm just gonna assess your precordium. So I'm just gonna lift your shirt up a little bit so I can see your chest. Good, so I'm gonna shine this light. Inspect your precordium. Very good, so everything looks symmetric. I don't see any heaving or pulsating, so that's a normal finding. Now I'm going to palpate, if that's okay. Okay, so everything feels normal. I don't feel any pulsations that I shouldn't feel. Let me just check your capillary refill in here. Good, less than 3 seconds. Very good. Now I'm going to check your apical pulse. Good, I feel it. It feels even and regular. That's very normal. Now I'm going to go ahead and auscultate your heart sounds using the diaphragm of my stethoscope. So first, I can hear the aortic valve, the pulmonic valve, and check Erb's point. You can hear the tricuspid valve and the mitral valve. Good, and I'm going to use the bell of my stethoscope to do the same. Very good. So I heard S1 and S2 sounds, no extra sounds. I didn't hear any murmurs. I heard all your valves normal, so that's very good finding. Now I'm going to check all of your pulses. So again, I'm going to check your carotids. +2, very good. +2, I'm going to check your brachials. +2 and equal with each other. Your radial pulses. +2 and equal. Your ulnar pulses I'll check. +2 and equal, very good. Your popliteal pulses. +2 and equal, and check your post-tibial pulses. Yeah, +2 and equal, and your pedal pulses. +2 and equal, very good. So now I'm going to auscultate your aortic artery. Good, so I don't hear any bruit. I also don't feel any thrill palpitating above it. Now I'm going to check your renal arteries. Good, I'm going to check your iliac arteries. And I'm going to auscultate your femoral artery. Good, so I didn't hear any bruit over any of those arteries, which is a normal finding. All right, well, that concludes our assessment for today. Very good.